Thank you, Joshua, for inviting me to talk in this workshop. And today I'm going to share with you some of the preliminary findings on the changes of the resting state brain activity after receiving night treatment in the patients at the acute and subacute phases following TBI. Okay, so why do we study TBI? Is because that TBI is actually global health burden, and some of the individuals following TBI, they actually suffer with multiple persistent post-injury symptoms like headache, problem with the concentration and memory problems, a number of them. So the evidence concerning the benefits of the non-pharmacological interventions to the post-injury symptoms is very limited. And then, however, so I guess all of you here would know much better than me that multiple cellular effects have been shown with the transcranial low-level light therapy, which includes to reduce the edema, reduce the inflammation, and increase the angiogenesis. So Dr. Margaret Nasher from Boston University, she is one of the few researchers who used light therapy to see the effects in the brain activity. And in multiple case studies that she reported an improvement in the cognition of these patients at the chronic stage following TBI. Okay, so in the TBI literature, we know that the first few weeks following TBI is believed as the critical window for neuroplasticity and the treatment application that may affect the recovery progress. So in our trial, we try to explore whether there is any impact of the acute, especially acute, low-level light therapy on the brain activity following moderate TBI. Okay, so how do we study the brain activity? So given that most of the post-injury symptoms also occur when the individuals are in the resting condition, they are not actually in the exercise stage or any kind of the, say, challenge state. So they are basically at rest. So we choose to study the brain activity using the to see, we look at the low-frequency spontaneous oscillation in the brain while they are at rest. We use the functional MRI to measure the brain activity. And both technique is one of the common technique that we used in the functional MR imaging. So, so here, we actually look at or measure the both signal changes when the patient might in the MRI scanner for 10 minutes in the resting condition without any challenges or performing any task in the scanner. So they basically lie there at rest, and then but definitely not asleep. They are awake, right? And then we measure the time series of the both signal changes over the whole brain, and we perform the correlation analysis of this time series. So here we have an example. We look at 3 different brain regions. So these are 3 different brain regions, and we extract the time series of the both signal changes. So if 2 regions, like these two brain regions, if the time series, say the brain regions, if the brain regions is, they are functionally communicated with each other, the time series will look more alike. So when we do the correlation analysis, you see that the correlation strength is pretty high. It shows a very strong correlation of these 2 time series of the oscillation. Okay. So, So Randy Buckner is another scientist. He actually reported say, multiple resting state connectivity, the resting state network for different brain function. And in the last 2 decades, we scientists usually use this connectivity approach to, say, study the abnormal brain function. So in TBI literature, we usually use the resting state functional connectivity to study the neuronal disruption following TBI. And increased connectivity, like this one here and this one here, the red color actually shows the increased connectivity in some of the brain regions. So we usually see this kind of the increased connectivity following TBI, except for those patients if they actually have associated disorders of unconsciousness.
Excuse me, Phoebe. I think we're not able to see your cursor. You might have to move it so that you can see it on that screen.
Oh, okay. Yes. That's the point. Yeah. Sorry.
Yeah, now it works. Thank you.
Yeah. Okay. So for these patients, if they have the acute TBI with associated disorders of the consciousness, so basically, instead of having the increased resting state connectivity, we see that there is basically no connectivity at all, especially for the coma patient. So increased connectivity that we saw following TBI, some of the studies, they suggest that it actually reflects the tightly synchronized brain activity between the brain regions in response to the damaged neurobiological substrate arrest. Okay, so then we have the, say, moderate size clinical trial, not the big size. And this is the study protocol of the clinical trial. We adopted double-blinded placebo-controlled design. So for each of the subject, we basically recruit our patient following TBI in the emergency room. And the inclusion criteria, they have, say, Glasgow Coma Scale of 9 to 12 or 13 to 15 with concomitant abnormal findings on the head CT. And so after we screen all these patients with the, say, they fulfill the inclusion criteria, they went through the enrollment procedures, and they were randomized to either the light treatment group or the sham treatment group. And so in terms of the treatment schedule, in the first 72 hours after TBI, after the traumatic brain injury in the emergency room, we'll apply the first treatment, the first light treatment. And after that, for the second and the third treatment, we'll apply it at a time interval of more than 12 hours. So all 3 treatments, it should be completed within the first week following the TBI. And say none of the members in the study team will know the treatment except for those who did the randomization or the person who applied the treatment. So we are all blinded to the treatment of the patients. So in terms of the MR scan, we look at the resting state brain activity. We schedule 1 MRI scan in the first week of the injury, during which the patient should be in the acute phase of the injury. And then, so we have the follow-up scan in the subacute phase, which is around week 2 or week 3. And the last scan was actually scheduled around 3 months when the subject were most likely in the late subacute phase. So we also have the healthy controls to look at the resting state connectivity to compare with the patients. But for all of the controls, we didn't apply any treatment. And they were only scanned once because supposing control shouldn't have much changes in the brain activity. So this is the helmet that we use for the treatment. And you can see that the light there are, say, 18 clusters of the light emitting diodes, which is lined in the inner surface of the helmet. So basically, it will cover most of the head, and the patient will not see whether the light is on or off. And obviously, for the patient in the treatment arm, we will switch on the light emitting diodes for the light treatment, and in the sham arm, we'll switch off all the diodes. So here, how we analyze the brain data. So after we collect the resting state functional MR data, after the pre-processing of the data, say the slight timing correction, motion correction, then we will extract the time series of the both data from each brain region. And altogether, we have 82 brain regions for each of the subject brain. And we use the software preserver to do the pulsation, automatic pulsation. So because we basically interested in the low frequency oscillation, we applied the bandpass, a very low frequency bandpass to the time series, and just looking at the low frequency oscillation of the brain activity. And then we performed the correlation analysis of this time series between different brain regions. So altogether, there are, say, 3,321 brain region pairs that we need to do the correlation analysis. And we lay out the correlation strength between the brain regions in the connectogram. So this is more easier to interpret. So here is the consort diagram showing the patient number at different stage of the trial. From the very beginning, you can see that there are around 4,000 patients were assessed for the eligibility, and 68 patients with the TBI were randomized. So this is the beginning, but when you look at the end stage of the trial, only 17 patients, the light-treated patients, were analyzed, and the data from 21 sham-treated patients were analyzed. So we actually look at a lot of the patients, but the attrition rate is also pretty high in this clinical trial, I can say. So these are the characteristics of the study patient. We try to do the, say, sex balance and also the age balance for the patient group. The most exciting part, the results. Okay, so the top row actually shows the cross-sectional comparison of the resting state connectivity, that is the resting state brain activity, say between the sham-treated patient and healthy control during the acute, subacute, and late subacute stage following the TBI. And the bottom row actually shows the comparison between the light-treated patients and the healthy control. So basically, by visual inspection, you will notice two things. One is the connection here appears in all of the patient, in all the comparison of between the patient and the control. So this is actually the connection between the left superior frontal region and the right superior frontal region. And the second observation that you can see is when you look at this pattern here and compare with this pattern, they look a little bit similar. But when you look at the pattern here, it looks more symmetrical. So these two, basically, they are, the first one, this one, is the comparison, the cross-sectional comparison of the brain activity between the sham-treated patient in the late subacute stage with the control. And here is actually the connectivity difference between the light-treated patient during acute stage versus control. And this one, the last one, is actually the comparison between the light-treated patient in the late subacute. That is the last stage that we study in the whole trial versus control. So you can see that it seems to be kind of progressing in here for the light-treated patient. And this one, it happens in the last stage. We study 3 stages here: acute, subacute, and late subacute. And for the sham group, this pattern only appears in the last stage that we study. But for the light group, this pattern appears in the first stage that we study. So this one shows the light impact. And these are the results for the temporal comparison between the light and sham-treated patients. So the columns indicate different groups, and the rows actually indicate different temporal comparison. So in the sham-treated patient, when we compare the sham-treated patient during the acute and subacute phases, we can see that the resting state connectivity decrease from the acute to subacute. That's why it shows blue. Blue means negative, the subacute minus acute. And here, from the subacute to late subacute phase, the connectivity actually increased. The red color indicate increase. Okay? So you can see that that is actually the V-shaped changes of the brain activity. But for the light-treated patients here, the resting state connectivity in the light-treated patient, they show greater connectivity than the controls, than the healthy controls, from the acute to subacute. And it continues to show the increase of the resting state connectivity in the late subacute phase. So it is the linear increase from acute, subacute, and late subacute. So when we try to compare the acute to subacute changes of the resting state connectivity between 2 groups of the patient, we can see that there is the significant difference in the connection among these brain regions here. So to kind of summarize all our results. So our results in the sham-treated patient, the resting state connectivity changes reflect the natural recovery of the resting state brain activity from the TBI injury. And then the greater acute to subacute connectivity changes in the light-treated patient actually aligns with increased resting state connectivity in other groups of the patient previously reported by Margaret Nasher and Chow. So those patients, they actually have chronic stroke and dementia. And after receiving the light treatment, they actually have the increase in the resting state connectivity as well. And so one interesting thing that we find here as well is the connection between the superior frontal region on the left and the right side in the patient. We can see that it consistently have the increased connection strength between these 2 brain regions when compared with control. So it implies the importance of this particular region in the interhemispheric baseline communication following injury. And so one important thing that we concern here is that because TBI is kind of tricky, the changes in the major life functioning still evolving over some of the patient, it will evolve over a period of 1 year, over 12 months period. So based on our results, we study up to the stage of the subacute phase of the recovery. TBI recovery. So it may be too early to define the therapeutic role at the moment. So we still need to monitor how the subjects behave afterwards. So based on our preliminary results, we confirmed that there is an impact of the light therapy on the resting state neuronal circuit during the first 3 months only. So this only tells the results for the first 3 months instead of afterwards. Afterwards, we need the further study to have, we need a larger sample and also need some correlation with the clinical outcome so that we can tell whether there is the clinical improvement for these patients. So these are the references. And I would like to thank all the members in the study team. Without their contribution, this study is not possible. So thank you.